This is a great story because it's exactly the kind of things of why somebody comes to work at Battelle. You know, we're a nonprofit. I can't give you stock options. So you come there to do good work, get paid a fair salary, but have a mission, be able to always be on the right side of every issue. And interestingly, I didn't even know about this, but about 3 years ago, we had done a study for the CDC. They had actually worried during the last Ebola outbreak. They actually worried that if an outbreak like that happened in the United States, would we run out of these N95 masks? And these are the masks that have higher filtration, that can actually protect you and the person next to you from airborne pathogens like a coronavirus. So we had done this very thorough 2-year study. We knew that vaporized hydrogen peroxide could kill coronavirus and lots of other things. We knew it was safe, and we had done the research to show that we could actually do it 30, 40 times before the mass would break down. So we put in a report and said, you know, you could do this 20 times very safely. And then we went on our way, and everybody kind of forgot about it. So as in the early days of the pandemic, and if you think back, the social distancing, the shutdowns we did really did work pretty well, and they were horrific on our economy and very difficult. But we saw the caseloads drop rapidly in many cities, and we've seen other countries that haven't been able to do this. We've seen quickly how their hospitals can get overwhelmed and how the death rates increase as those hospitals get overwhelmed. So we had a young couple, one of my engineers who was part of that study, his wife worked at one of our local hospitals, Ohio Health, and she was starting to talk about, they were already, this was before we even got to shutdowns, they were already running out of these N95 masks. And he knew we had done this study. So he actually shot a note up through the management chain. I had just met with our team a couple days earlier. Once we saw the virus get to Singapore and the number of cases growing, we kind of assumed it was coming here. There was really no way to stop it. So I told my team, what are we going to do to fix this? What are we going to do to help? Don't worry about money. We'll figure it out later. So we had our team kind of thinking about ideas, and this idea came up. And so we very quickly put a team together, and we actually built a mechanism to scale this from doing a couple masks to being able to do up to 80,000 a day out of a single system. And we did it in 9 days. People literally work 24 hours a day. They built these big ISO vans that you see on the road, and you can, in racks and shelves, and you can put these masks up. We worked on a process to tag every mask so you can keep track of them. We worked with our partners at Ohio Health, who was the hospital that my engineer's wife was from, and they helped us understand how hospitals, the logistics would work, and how to actually do this. And within a few days after proving that in, we were actually able to get the emergency authorization from the FDA, and there was a little bit of press and some politics around the speed of that. If you remember, because at that time, we were all going very exponential in the number of cases. It was just before the shutdown, and you know, we actually thought, and FEMA thought, we would be seeing millions and millions of masks needing to be cleaned every day, and we were going to be short by billions. The shutdown actually helped. We didn't see the cases rise to those levels, but we were able to, with the help of the government, we got a contract to actually build 60 of these systems, and each system is 8 full tractor trailer containers, 4 of them that the masks go into, and 4 more for logistics and showers and protective gear for our folks. We were able to put those deploy those through the Defense Logistics Organization into most of the states of this country. We put 49 systems out, and they had 11 extra systems that we have on standby for hotspots. And those have been out running now for a number of months. We've, in the next week or two, we'll clean our 2,000th mask. It's worked really well. Since that time, we had the initial studies. NIOSH, who is the organization that sets the standard for these masks, has actually been able to take masks that we've cleaned 20 times, and we've proved that they work and the masks aren't harmed. 3M, who is the maker, one of the major makers of the mask, has also done that, and we've been able to cycle masks for them, and they've taken masks. We've also worked with Massachusetts General up in that area through masks that have been through 5 to up to, I think, 10 cycles, and we've been able to continue to prove in the technology. What I'm most proud of is, for me, this was personal. I've got a daughter who's a doctor and a niece who's a nurse. And when this all started, my daughter's hospital was giving her 1 mask a week, and they were putting surgical masks over top of it. We saw other hospitals that were giving doctors 1 mask a week, and they were telling them to put them on their car dashboard overnight and hope that that would do it. So, you know, lots of home remedies and grandma's remedies out of necessity. And what I think we found, we've got 20,000 locations, or 23,000 locations, I think, in the country signed up that are using this, down to nursing homes to first responders to big hospital systems, and everything from some people send us 10 masks, some people send us thousands a day. This is anecdotal, but I think every system we're working with has gotten back to at least having one clean mask per day for their doctors and their clinicians and nurses again. So I think it really has made a difference. It's a stopgap solution,
Sure.
but I'm proud of the team, and I'm proud of how quickly they responded. We also took 300 of our people. We stopped a lot of the work we were doing, and those people did some quick training because they already knew how to deal with biohazards, and they deployed all over this country, including some of the most dangerous places in the country. They volunteered. We've hired another 700 people since then that have gone out and been trained in our facilities here in Ohio, and then gone out and done this mass cleanings, and it's gone really well. I couldn't be prouder of the team.
So I think, from the outside, it would just seem like we are in a retrench mode, but we are in some cases, because let me paint the business backdrop briefly. So Jan and Feb were record months for us, and that's over 5 or 6 years of record revenues, record passenger volumes, customers flying more and more. And then Jan and Feb were true to form. We were doing great. We were ahead of plan and flying record volumes. And then first week of March, we start to see the softness. And from the second week of March, it's almost like the bottom falls out. So within about 3 weeks, I've never seen a business environment decline as rapidly as this one did. In 3 weeks, we went to 5% of our customer volume that we would have normally expected. Think about that, right? We lost 95% of our volume within a short 3 weeks in March. So what was great was, my boss, our CEO, setting very clearly in that middle of March, literally the week of March 9th, he had set 3 priorities for the company. And priority number 1, true to Delta culture, people first, culture, deep-rooted, was we're going to protect our customers and our employees. We're going to take care of our customers, we'll take care of our employees. So that was priority 1. Priority 2 was we were burning $100 million a day in cash, right? And no business, no matter how well your liquidity is and what kind of a war chest you build, no business can sustain that for long. So priority number 2 was to make sure that we preserved cash. And priority number 3 was sort of don't do anything stupid, because we are going to come out of this. We are going to be a strong survivor. In fact, if we do this right and play to our strengths and accelerate some of the business technology transformations that were already in plan, if we accelerate that, we will come out even stronger on a relative basis, right? It's going to take us 2 to 3 years to get back to where we were, but on a relative basis, in 12 months, we could have made so much progress. So that's the business backdrop. So it did involve some amount of, as our CEO said, putting the airline to sleep, right? So you see pictures of those planes lined up in the desert. And we didn't just do that. We went a step further and we said, hey, to avail of that priority 3 and accelerate it, why not take the MD-88s and 90s, which we were going to retire in 5 years, and just go ahead and retire them? And then we took another step, another very bold step, and just retired the 18 777s in the fleet, right? Because we have long-haul planes, which are the 350s that are capable of doing those routes. So we'll just fly 350s when we come out of the crisis. So definitely from a optics perspective, when you see the visual of hundreds of planes of all brands and all logos lined up, in the desert in Arizona, and you hear announcements of 95% off on volumes, and you hear about the fleet retirements, you would think that that is all we're doing. And that is not all we are doing, right? There's absolute heroics going on. You called it, acrobatics, heroics going on. We are still flying, right? We're flying 1,000+ flights a day. And that means thousands of our frontline teammates are serving customers. And the customer travel isn't discretionary sightseeing and tourism right now, as we all know. it's absolutely essential, not just to the country, but to the world. So we're flying, medical supplies. We're doing an immense amount of cargo. We're flying medical personnel. In fact, we've done that for free to some of the hardest hit locations where we'll just let volunteers fly on Delta for free. We're repatriating thousands, tens of thousands of our colleagues, United States citizens, who are stuck in all parts of the world. And so these are Department of State flights that are contracted and that we run them back from Mumbai, for example. We've run, 8 or 10 of these flights, a couple a week to bring people back home. So there's so much of that, or people just wanting to go see sick, near and dear ones. We're doing all that. We're an essential service. So the heroics that go on in front of the customer, that people are putting themselves out there every day, even though they're going through the same personal, thought process that you and I are going through about health and safety and concerns, they're not batting an eyelid. I mean, that is the strength of our company, and we're doing that. Behind the scenes, there's been so much, that we've done in terms of getting from 100 million down to 50 million burn right now, on our way to 35, on our way to 0 by the end of the year is our avowed goal. So our finance teammates have done Herculean work on that. Our HR teammates in keeping everything, stable and morale high. Supply chain. I mean, we weren't out there looking for masks and sanitizing, disinfectants, and any of those things, right? Or electrostatic fogging equipment. That wasn't even in our plan 90 days ago. And our supply chain people have jumped through hoops to get that. And the same with IT, right? We've done a lot in terms of enabling people, thousands of people overnight to work from home, procuring, laptops. Luckily, we had them warehouse. So we had those, getting our MS Teams and our WebEx platforms working flawlessly from a collaboration perspective, and then making sure that refunds, which there's a lot of noise out in the media about, and are the airlines doing refunds? Well, let me tell you, I can't speak for the industry, but our airline, we have refunded $1.5 billion of cash refunds since this thing started, and the volume has been immense. So,
but we saw some real creativity occur that I did not expect. So one company, Farmer's Fridge packages fresh salads in a mason jar format, plastic mason jar, and they distribute those mason jars through kiosks. Those kiosks are placed in corporate lobbies and airports. Well, there's no traffic in corporate lobbies, and there's no traffic in airports right now. But they are, within 6 weeks, they're back to 90% of their peak revenue. So they could have stepped back, the CEO could have stepped back and I think joined the majority of saying, we need to cut our staff by 50% or 80% because we have no revenue. We need to do all sorts of extraordinary things on the expense side. Instead, he restructured the way his company would deliver his product and took the same product, made the same way every day, and delivers it to hospitals and other organizations, schools, whatever, that need to buy his product, that need to take advantage of it. In fact, they think it's a godsend because they typically don't have cafeterias open in this environment. They don't have great sources of food, and they get it. This way they could eat healthy and fresh every day. So Beyond Meat, the same thing. Beyond Meat had to shift a lot of their revenue from food service side to the retail side. They've taken advantage of some of the news you've seen recently of meat shortages because plants are closing down. So we are seeing a lot of creativity, which obviously is one of those leadership characteristics you asked me about. We've seen a lot of creativity come out of this, which I think is positive and maybe lasting beyond the COVID crisis.
Did about 1,180 small business financings, and that's more than we do in several years combined. 7 days a week for well over a month, and morning, noon, and night. And it was an amazing effort. But the outreach and the outpouring of affection we received from clients with emails. I have never seen anything like it before. Clients are expressing moved to tears, and because of exactly, Vinnie, what you're saying, and I'm so glad you shared that, and I appreciate you saying that. And Chris is outstanding, and thank you. Keep the ride going, and keep telling all your friends to come bank at First Citrus.